So anyway, good morning. It's an honor to be here, and in particular to welcome the Czech integrated care ecosystem into the family of the European Connected Health Alliance. I just want to take you through some information on the Alliance so that you understand what we do and what we would like you to do with us in different parts of Europe, the US, China and Canada. So let me take you on a very quick journey through this. You will see that we are a not-for-profit organization. We have over 500 members now, and the key to this, as you'll see from the words on the screen, are that we want to deal with all the stakeholders, because an ecosystem by its nature needs to have everyone interdependent on each other. So we bring academia, industry, government, patients, venture capital, private equity, health insurance companies, economic development agencies, and many others together to create progress. Because all too often we find in different parts of the world that really good ideas don't always make it to the front line, don't always get from either the university or industry or government to help citizens and patients. And so I started the ECHAlliance about 5 years ago because I was learning good things were happening, for example, in my home country of Northern Ireland. And then I was finding that they were not telling anyone about this, and they didn't have the mechanism or the structure to produce and recreate that success somewhere else. So as you'll see, we really connect with a lot of organizations throughout Europe. What we're finding is that it is not enough to want to work together. It's essential that there is a way to join you together with other people, as you're doing here today in this room. It's great to have representatives from industry, from government, from universities, from other social care, from health, in the same room. Because that's the beginning of building relationships which build trust, and then you start working together. That's our experience everywhere we go. Our meetings throughout Europe meet every 3 months, because that builds a community. They tackle specific problems or priorities in their region, and I'll give you an example in just a moment. And as a result of doing that, everyone benefits, particularly we, because sometimes I find we talk about patients or others as if they were someone different. We're actually all citizens and human beings and patients sometimes as well. So there's a selfish reason for us to make sure that things are better connected. So you will see that this was a quote from the former commissioner in the EU, the lady from Holland, and we're still working with Nelly Kroes in her new role in her home country of the Netherlands. And she is passionate about ecosystems and about joining the dots, as we call it. You will see that, just as Tomasz was saying, this is about connecting all of you with each other, and then connecting all of you with similar people in many different countries. So these are the basic principles. There has to be some geographic coherence. So for example, in the Czech Republic, here you are. In, for example, Spain, we have ecosystems in places like Catalonia, in Andalusia, in Valencia, Galicia, and soon in Madrid, because each of those have regional governments, and each have got sometimes slightly different priorities and different reimbursement systems. We want them to be permanent, because whilst events are good to have, it's really important that they are consistent and they build a community, because that's how real work is achieved. We try to support governments and organizations that have got a strategic plan. I know here in the Czech Republic, You are working hard on the e-health strategy. And later this morning, you will hear from the Irish government about how they wrote their e-health strategy. In fact, the person who wrote the strategy is with us today. And how they're using an ecosystem to help them implement that strategy. Because strategies are no good if there's no implementation plan and no acceptance by you, the stakeholders, to help implement it. So we also have found over the years that because we have a very attractive network in Europe, we've also been approached, for example, by the Ministry of Health in Beijing, who 1.5 years ago came to visit us and said, can we please have the China Connected Health Alliance? Now, you all know the numbers in China are always difficult to comprehend. But one figure sticks in my mind in China. On my most recent visit to Beijing, I met with the officials from the Ministry of Health, the Ministry of what's now called Welfare and Family Planning, the Ministry of Public Security, which covers the internet, data, etc. And I find in China you've got to have all the ministries in the same room. Just like here, you have to have everyone in the same room. And interestingly, the Ministry of Sport, which is now taking a leading role in the prevention business, trying to educate people to prevent obesity. They're using their gold medal winners from Olympic Games to actually be role models for people in China. The statistic that stuck in my mind was this. In 5 years' time, there will be nearly 300 million people in China, 60 years of age and over. That's both frightening and an opportunity. But the statistic that worried me more was that that means there will be more people over 60 than under 16. So because of the one-child policy, etc., they're going to run out of workers, people who can support their parents. So now what you've got is a crisis which the Chinese government know about, and they're looking for ways and for help from people like yourselves to help them solve their major problem. In China, they have a word which is weijie or weiji, depending on which part of the country you're from. But it means there's only one word, and it means crisis, and it means opportunity. So they're looking to the West to help them solve what they see as a crisis, but we in the West can help them and see it as an opportunity. We also now work closely in Canada, where we find that the Canadian government's approach to integrated care, health and social care together, is actually quite similar to some of the countries here in Europe, more so than the American system, which is a different reimbursement system, as we all know. So we have now, in fact, the day after tomorrow, we will in Toronto launch our Ontario-Toronto ecosystem. I can't be in everywhere, but I'll be attending by Skype, and if that doesn't work, by FaceTime. And we're now launching that, and will launch ecosystems in other parts of Canada over the next 12 months. In the US, in New York, Massachusetts, and on the West Coast, we have people there who see the ecosystem network in Europe, now including you, as their window into Europe. And of course it works both ways, because they are your entry points into the US if you want to do business there. And there are many incentives to do business in America by having a presence in New York, Massachusetts, etc., where they will give you money just to set up your business there, where they will give you loans which turn into grants if you stay long enough, etc., etc. This is where we are at present. So if you look at all of these countries, those that are existing, and we see proudly at the top, we now have yourselves there as part of the family. The launching within 6 months, well, Toronto launches day after tomorrow, so that'll move to the other column. And some of the others actually, even when you look across on those in progress, you will see that, for example, in the Basque Country, that actually will happen now. As of a couple of days ago, it'll happen within the next 3 months. So these are all part of the negotiations and discussions we have in every single region These slides will be available to you afterwards, so you don't have to memorize everything. I want to issue a number of invitations now to the ČEIP ecosystem. And I really would like the working group here to accept these invitations and to participate fully. We are finding that not only can you, as the coordinators, participate in our monthly coordinators meeting, where over 30 coordinators meet and talk to each other about what they are doing in their country and finding projects to work on together. But we've also created a number of working groups at the request of our members. So my invitation is this. I would like the ČEIP ecosystem to find representatives to sit on these working groups, including the eHealth Strategies group, which is very timely, where you can contribute to that group. It is led by the person in Estonia, the Estonian government, who wrote the first 10 years eHealth strategy for Estonia and has now written the second 10 years. There are not many countries in Europe who can say they have over 10 years of eHealth strategy. Estonia is probably the most advanced country I found in Europe in everything, not just health, but e-government. So I think that we in that group would welcome someone from the Czech Republic to represent you and the work you're doing, so that you will gain knowledge and you will provide knowledge. The second is the medicines optimization group. Every country has the same issue, not only the waste of pharmaceuticals. We all have lots of tablets in our bathroom cabinets that we decided we didn't need any more of those, and they sit there and they amount to thousands and millions of pounds and euros. What we have discovered as well, of course, is that many people forget to take their medication. It's not that they don't want to, they forget. So in my home country of Northern Ireland, it was costing our government an extra 112 million UK pounds a year because people forgot to take their medication. The other problem was it meant many people were brought to the emergency room in an ambulance in the middle of the night. It meant they stayed overnight. It meant that operations for the next day were postponed because there were no hospital bed for them. So we assisted the government there through the ecosystem in introducing new ways and new tools to reduce that problem. And it seems to have been reduced by something like 60 to 65 million pounds a year through a very simple approach to it. So these are the specific, real benefits you can get from working together. Because in that instance, the government did not know what solutions were out there. They didn't know enough about what industry had done in other countries. So we were able to supply that. And the final one, which we're launching next month in Amsterdam at eHealth Week, is the Mental Health and Wellness Group. This is a huge topic. I don't know in the Czech Republic, but certainly throughout the world. There's a realization that mental health, which used to be something you didn't talk about, is something we have to talk about, and we have to do something about it. So we're forming that group, and again, there's an invitation to you to propose and apply a representative or representatives to that group. So there's 3 working groups. It'd be great if the Czech Republic could be represented in all of them. Because we now have such a huge network of like 120 meetings a year in Europe, we now have had to create an online platform. So it's not enough to have the human network, but we now have to have an online platform. So again, you're invited to put your profile on our connector platform on our website, and from that you will receive news across Europe in this field of what's happening. So while you're reading that, I'll just say this to you. There's also the final invitation to everyone in the room. We're a membership organization. We're funded by membership contributions, mainly from industry. So for anyone who's in the room that is in the public sector, that is in the not-for-profit sector, universities, public hospitals, not-for-profit organizations, you can join us online free of charge. There is no charge. If you're a startup company, You can join us where the first year is free. And if you like us after that, and you think we've been of any help, you can pay us €450 a year only. What does that do for you? It gives you access to every meeting we have in Europe. It gives you access to markets, to people who are in the same business as you, whether it's academia or companies. It also gives you access to our foundation partners who are major companies like Cisco, Dell, EMC, Roche Laboratories, Intel, these sorts of people who are looking for startups, looking for connections and partnerships. So I would invite you all to look at becoming a member of the ECHAlliance, as well as being a member of the Czech ecosystem. We're also quite involved in different events, and the one that's coming up very soon is the eHealth Week in Amsterdam. And again, we would welcome any of you who are going there to attend our open session on the 9th of June, where we will give you a journey across Europe and give you an idea of what's happening throughout Europe in this field. We also do some work in China and various other places on events, but the main thing for us are the ecosystem meetings. This is the bread and butter, the core work, and I really encourage you to keep this as active, energetic as it is. In closing, I need to say some thanks to some people. First of all, to everyone who's organized today, because it's quite clear to me, and you all know, these events, and there are many events, don't happen just because someone sends out an email. So I'm really grateful to the organizers. I'm particularly grateful to Tomasz, who I first met about, I guess, 16, 17 months ago, when I did a presentation in Bucharest, in Romania. And afterwards, this young man came up and said, I like that, we need that in the Czech Republic. And I was a bit unsure about that. I came to the Czech Republic maybe a year ago and met with a number of you here, Michael, who I see is in the audience, and a number of others. And it's quite clear to me that the dynamics here in the Czech Republic and the fact that an ecosystem is being created is happening at exactly the right time for you and for us. So I'd like to thank Tomasz, wherever he is, for his persistence and his strategic view of things. I'd like to thank all of you for attending today, and I'll be available all day and more than happy to meet you and to answer any questions you may have. So thank you very much for listening.
Just please remain for a second, Mr. O'Connor. Já se zeptám, dámy a pánové, jestli je nějaká otázka na pana O'Connora. Yes. Vydržte, až u vás bude mikrofon, jenom prosím.
Hi, Marcela Janečková. I just would like to ask, there is a European Commission Action Group on Integrated Care. They also do best practices, and it's like similar kind of network. So I just wonder whether you somehow cooperate, or whether this is something different, or you compete, or I just want to know whether you cooperate, whether if I look to best practices in there, whether it's something different, or whether I can find best practices.
Well, let's symbolize it. Cooperation or competition. It's the base principle of your question, yes? Thank you.
I heard your very polite question to his very direct question. But the answer is we cooperate. I should have said that we, as the ECHAlliance, are members, for example, of what's called the B3 Action Group on Integrated Care. So I sit on that group, mainly on the financing of integrated care, financing new ways of financing integrated care, basically, is what I contribute. But many of our members sit on the action groups of the European Innovation Partnerships. Many of our members are also reference sites under this collaborative network. And we also participate in EU projects, because so many of our members ask us to find partners for them. Because as you all know, when you do EU projects, you've got to have members in different countries. So we are able, through our membership, to very quickly bring partnerships together. And we act either as the coordinator or a work package or a dissemination outfit. So the answer is definitely cooperation and collaboration. Makes sense.
Thank you for your answer.